Hello everyone, welcome to sqadia.com. My name is Hira Imran, and today in the Radiology series we will talk about elbow and forearm. So first let's cover all the topics that we're going to discuss in today's lecture. Let's begin. So first we're going to talk about trauma and acute conditions. So acute conditions are anything that are as a result of some accidental injury due to fall or some sporting injury. So we're going to discuss different fractures in as a result of acute trauma. So we're going to discuss some fracture classifications based on age and the type of fracture, and let's see what we're going to discuss in the acute conditions. So in acute conditions, we're going to first talk about elbow dislocations and how we name elbow dislocations. And with elbow dislocation naming and everything, we will also discuss how the elbow joint appears on different views when we're talking about X-rays and other radiographs. So then we're going to talk about fractures. In this fracture portion, we will discuss different fracture classifications and based on the age of the patient and other factors as well. Then we're going to move towards the tendon ruptures and the tendon tears, which are as a result of some acute injury or some sporting or falls. So this is abrupt rupture and not the rupture that is as a result of continuous stress. So we will discuss two types of ruptures. First, the ruptures which are as a result of some abrupt injury, which come under the heading of acute conditions, and then we will also talk about tendon ruptures in the chronic conditions section as well. So then we will move towards the chronic conditions. So in chronic conditions, we will talk about the arthritis. We will discuss arthritis as we have discussed in the previous lectures as well. So we will cover arthritis, and the difference between OA and RA is that osteoarthritis or OA is actually due to biomechanical wear and tear of the joint surfaces. And there are a couple of characteristics associated with it. So there is sclerosis, which we have discussed in previous lectures as well. So there is osteophyte formation. Then we have some reduction in the joint space. So those are all the characteristics of OA. And RA obviously is a very a serious disease. It's actually an autoimmune disease where the body actually attacks its own body parts. So we are going to also talk about in chronic conditions some tendon ruptures, which are as a result of chronic stress. So in this lecture, we will completely discuss all of these different conditions, and that is it. I hope you want to watch the entire lecture as well. So thank you for watching.